Right now we're going to do inhalation cranial assist. So I'm going to find a strong indicator muscle right now, and that is strong. We're going to do autogenic inhibition, boom, 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 and that went weak. So we'll give it a second to rest, test it again, strong, good indicator muscle. So right now we're going to go P to A on the mastoid, while the patient breathes in. We're going to test, strong. P to A on the opposite mastoid, while the patient breathes in, and it goes weak. So we're going to do 4 to 5 times on that mastoid while the patient breathes in. Test again, and it's strong. Now we'll do exhalation assist on exhalation cranial assist. So we'll go A to P on the mastoid while the patient breathes out. Retest, strong. A to P on the opposite mastoid while the patient breathes out, and it goes weak. So we'll push A to P on the mastoid while the patient exhales 4 to 5 times. Retest, nice and strong. Now we're going to do sphenobasilar inhalation assist. So what we'll do is we're going to go A to P on the mastoid, and then on the hard palate, but I'm not going to go inside her mouth. And we'll have the patient inhale as I press, and then we'll retest. Same thing on the other side. Breathe in, and it goes weak. So then we'll do 4 to 5 times, just like that. Breathe in, breathe in, breathe in, retest, strong. This is sphenobasilar exhalation assist. So I'm going to go A to P on the mastoid while I'm going P to A on the maxilla while the patient exhales. We'll test. Nice and strong. A to P on the opposite mastoid while P to A on the maxilla while the patient exhales. Retest. So weak. So then we're going to go ahead and do 4 to 5 A to P's on the mastoid along with P to A on the maxilla while the patient exhales. So retest, super strong. Now we're going to do EOP glabella. So what I'm going to do is I'm going to push on the glabella and the EOP at the same time, and then we're going to test, and it goes weak. So what I'm going to do is I'm going to press on the glabella and the EOP while the patient breathes in through the mouth. Test, strong. Same thing while the patient breathes in through the nose. Goes weak. So I'm going to go the EOP and the glabella, and we're going to press down on those while the patient breathes in 4 to 5 times through the nose. Retest, super strong. This is the glabella cranial fault. I'm going to press on the EOP and the glabella at the same time and test the muscle. It goes weak. So now we're going to do the same thing with the glabella and the EOP while the patient breathes in through her mouth. Retest, goes strong, breathe in through your nose, goes weak. So now we're going to do EOP and glabella while the patient breathes in through her mouth, since that one's strong. So 4 to 5 times. And retest, strong through the nose, retest, strong.